Good afternoon, and thank you for joining us for the October 14th virtual news conference. My name is Mariah Miracle. I serve as a public information officer in the COVID-19 Joint Information Center. Joining us today is Humboldt County Public Health Director Sofia Pereira and County Health Officer Dr. Ian Hoffman. I'll start today with a brief update from the Joint Information Center. A total of 8,985 Humboldt County residents have tested positive for COVID-19 as of yesterday's report. 430 cases have been confirmed in the county in the first 2 weeks of October, and 17 hospitalizations and 10 deaths from the virus have been reported this month so far. Of the nearly 119,000 Humboldt County residents who are age 12 and older and eligible for COVID-19 vaccination, about 78,000 or 66% are fully vaccinated. Nearly 8,000 more are partially vaccinated, which means that more than 32,000 vaccine eligible county residents remain unvaccinated. Resources are available locally for both COVID-19 testing and vaccination. Anyone with questions can reach out to the community information line at 707-441-5000. We're open Monday through Friday from 8 a.m. to 5 p.m. and answer questions in English and Spanish. Now we'll hear from Public Health Director Sofia Pereira. Can you please share an update?
Thanks, Mariah. Good afternoon, everyone. So first of all, we shared this week that we've been contracting with the Public Health Institute to provide additional contact tracing and investigation staff to our investigations unit. And so we've been rolling that out this week and really grateful for that partnership. It's a very seasoned team to integrate into our local seasoned team. And this is going to help us with the outbreak response work that we are doing across the county for our targeted populations, at-risk populations. As you probably have heard, we are seeing more folks at our vaccine clinics with the news of boosters for Pfizer, those that are eligible. But our focus is still remaining on reaching the unvaccinated in our community. That is our top priority. And so we have enough supply both to reach those that are seeking boosters that are eligible, but I want to make it really clear to folks that are unvaccinated in this community that we have enough supply for you. So please don't let the news of boosters and the news that people are going out and getting their boosters mean that there's not enough for you. There is, and so please make it to one of our clinics so that you can get vaccinated. Thank you.
Thanks, Director Pereira. Dr. Hoffman.
Thanks, Sophia. Thanks, Mariah. And thanks everyone for being here today. I want to just highlight a couple of points around the epidemiology, where we're at, and then talk a little bit about the vaccination and the boosters, follow up on some of what Sophia mentioned. So we do continue to be in an area of high concern by the CDC standards, still continuing to be a high transmission or red tier on the CDC data tracker. Our case counts are dropping overall, and we are finally back to a place where the case counts are lower than they were, or I should say about where they were at the surge peak in the last couple of surges, which would still land us in the purple tier on the CDPH blueprint metrics. So while cases are significantly down from the last 2 months, they are still quite high. And we are still continuing to see hospital impact from that. The hospitalizations, while the case counts are lower, the hospitalizations still remain higher than they were in the previous 2 surges. This is because the surge was much higher. So even though the case counts are coming down, it takes a few weeks for those hospitalizations and deaths to come down because of the lag time in those indicators. So, just want to continue to caution people that there is still a lot of virus out there in our community and the risk is still quite high. We continue to see the hospitalizations and death are overwhelmingly in the unvaccinated. And despite the numbers that Mariah mentioned, where the majority of our population in our county, now at 57% of the total population, are fully vaccinated, the numbers that we see in the unvaccinated hospitalizations and death make up a much larger proportion overall of those numbers. So the risk is still quite high for the unvaccinated. We are seeing that differential in the age groups as well, from the unvaccinated to the fully vaccinated group, in terms of who's getting hospitalized and dying from the virus at this point. And this is a reason for those people who are fully vaccinated and older, or who are immunocompromised, to really go out and get your booster, because we are, there is in those populations specifically, we are seeing a decrease in the effectiveness of the vaccine. So if you fall into one of those approved groups, please, we do want you to go out and get your booster shot, or your third shot if you're immunocompromised. We continue to have monoclonal antibodies available in our county. The monoclonal antibody clinic at St. Joseph's Hospital in Eureka will continue to be here at least through the end of November. So please, call your doctor if you are at high risk for COVID and were exposed, or if you are at high risk for COVID complications and you are COVID positive, and yet they can get you into that clinic and get you the monoclonal antibody, which is highly effective so far. Of all the folks that received that antibody treatment, none of them have been hospitalized. So very, very effective. But I do want to point out that the effectiveness of those monoclonal antibodies are short-lived time periods. So we do still encourage folks who are COVID positive to go ahead and get their full vaccine doses, to get vaccinated. If you had the monoclonal antibodies, you should still get vaccinated. You should wait 90 days before you seek out vaccination. But at this point, all the data still suggests that getting the vaccine is still the most important thing for you if you're unvaccinated. So the bottom line is that things still haven't changed in terms of where we're at with the vaccination effort. This is still the best tool for us to get out of the pandemic. As Director Pereira mentioned, those first and second doses are extraordinarily important. We want to continue to really do everything we can to increase those, and also support the boosters of those who are eligible as we go forward in the vaccination effort and try to reduce the impact of COVID-19 on our community. Thank you.
Thank you both very much. Now we'll move on to questions from reporters, starting with Isabella Vanderheiden from the Times Standard.
Hey, thank you for taking my questions. What are the JIC's recommendations as worries about the twindemic arise again this year? Should people get boosters and flu vaccines, with people losing basic flu immunity to the common cold through the use of masks and social distancing? What are the projections about a spike in COVID cases and a spike in common flu cases this year?
Yeah, great question, Isabella. So, we really saw virtually no flu last year because of all of the COVID precautions that were in place. And one of which is masking, but there were a lot more. We had restrictions on public movement, restrictions on gatherings. So, I think all of that together really had a huge impact on the flu. We know that masks are impactful on the flu, so I would expect that masking throughout this winter will have some dampening effect, but because all of those other things are not going to be part of what's going on this winter, we are expecting to see a rise in flu cases. We've already had a couple. What that's going to look like in terms of how that interacts with COVID is, I think it's a big question. So our best tools against it are the same tools we were using right now against COVID, which are masking, which will continue, and the vaccine, which will help for both of these. So getting vaccinated against influenza, which are available currently at pretty much every pharmacy across the county, and in your doctor's office. So, and strongly encourage people to go out and get their flu vaccine. Now's the time. We want to get it in, around this time in October, November, before the holidays hit. Just like COVID, it takes a couple of weeks for full immunity to set in. So generally about 2 weeks after you get the flu shot is when you have the best immunity against the flu.
Thank you. And I guess I would just follow that with, it might be too early to determine, but has public health seen more resistance to getting a flu vaccine than years past with so much resistance to the COVID vaccine?
I have not seen any indication of that, no.
All right, thank you.
Do other reporters have follow-ups on that topic? All right, Ryan Hudson from the Redheaded Black Belt.
Hi. Okay, so my first question goes to what we learned at the Board of Supervisors meeting this week. Earlier, so Linda Lee said that less than about 1,000 county staff had returned the self-attestation form to the county out of about 2,400, and please correct me if I'm wrong about those numbers. So my question is, for county employees who are attesting to being vaccinated and therefore not having to undergo the weekly testing for screening COVID at the workplace, do those vaccinated staff members need to provide proof to the county that they are indeed vaccinated? Or is it a matter of the honor system as far as the attestation form goes? Thank you.
Ryan, thanks for your question. So given that the Board of Supervisors is still will make their final determination about the policy, and then it'll be up to the CAO and to Human Resources to determine the implementation of that direction from the board. So we at Public Health will be awaiting that direction on what their policy will be on that. Thank you.
Okay, thank you. I appreciate that.
Any follow-ups on that topic?
Hi, I actually do have a follow-up in regards to that plan. So I wanted to ask, do you think the supervisor's plan to not mandate vaccines for workers and instead require unvaccinated people to get tested is a wise policy at this point in the pandemic?
Austin, thanks for your question. So, surveillance, and Dr. Hoffman can definitely expand on the importance of surveillance testing. So we at Public Health, we are supportive of any measures that are going to help protect individuals in our community. And so testing obviously is a really key component of that, as well as vaccination. So it's really up to the board in terms of looking at all of the different considerations in determining a policy. And so it's up to the board to decide, what goes into that final decision. But there's obviously a lot of complexity to these types of policies and what they look like on the implementation side of things.
Yeah, and as I said on Tuesday, we at Public Health, we support anything that increases vaccination in our county. And I think this is a move towards increased vaccination in the county staff. So it, based on the evidence to date, these kinds of policies do move people to become vaccinated. And they, just like Director Pereira mentioned, will add a layer of protection of surveillance testing for those folks who are not vaccinated. So, I think these policies are ones that we're all going to continue to see coming from all levels, from federal government, from state government to private business entities who are looking out for their own interests, implementing these kinds of policies.
Great, thank you so much.
Thank you, Austin. And we're actually coming right back to you for your question.
All right, perfect. Kind of related to the same topic, but going back to Tuesday's Board of Supervisors meeting, many supervisors cited misinformation as being a major reason behind vaccine hesitancy. Some of them even urged Public Health to do more to combat this misinformation. And so I want to know, what are your thoughts about suggestion that Public Health isn't doing enough to combat incorrect narratives about the vaccine online? And what more do you believe can be done?
Austin, thanks for your question. I think this concern about misinformation is something that I think everyone in our community is concerned about. And the issue of misinformation, I think, is also much bigger than Humboldt County alone in terms of the conversation about misinformation. We at Public Health, since the very beginning of this pandemic, we started up our Joint Information Center. So we've had a call center available to the public several days a week. It's currently 5 days a week available for the public if they have questions. We are active on social media. So we are providing science-based information to the community using vetted information by the CDC and CDPH, making sure that is getting out to the public. We are sharing information about vaccine opportunities, testing opportunities, making sure that folks have as much information as possible. We really pride ourselves on being a trusted source in this community. And so we've been doing this for 1.5 years, and we are always looking for opportunities to share the trusted evidence-based information with the community. We're going to keep doing that as long as we're in this.
Yeah, and we continue to, through those avenues that Director Pereira mentioned, promote evidence-based guidelines from the CDC, from CDPH. We've worked regionally with our health officer partners across the Rancho, Northern California region to produce a document that got at a lot of these myths. That was done several months ago. It's on our website, and certainly encourage all of our media partners and all of our community-based organizations in the area to promote that. But as Director Pereira mentioned, this is a big issue across the board, across the nation. And I think we're really thankful for so many partners in our community who do spread truthful information. There's always going to be someone out there who's willing to spread misinformation, but I think as opposed to a lot of counties surrounding us or similar rural areas across the country, we've done much better, and the messaging actually has been very supportive of vaccination and getting the truth about vaccine out to our community.
Great, thank you so much.
Any follow-ups on that, on misinformation in Humboldt County from other reporters? All right, we'll go back to Isabella from the Time Standard.
Thank you. And Austin, that was actually my exact next question. So thanks for covering that. So Trinity County offers $50 to residents for each COVID vaccine received. That's the first and second shots. So is Humboldt County considering any similar initiatives, or is it simply more so relying on local businesses to offer such incentives?
Isabella, great question. So I think throughout this vaccination effort, there's been a variety of incentives offered to the public, whether they're through the state or businesses. And we have been working on providing incentives through grant funding that we have. So that is something that we are in the process of implementing, but we have several partners that have been really key in providing incentives. But we also know that incentives are not the sole driver of getting folks out to get vaccinated. They're incentives. They can help reduce barriers. And gas cards, for example, are a great way to reduce a barrier for someone to get the transportation they need to get vaccinated to cover that cost. So, we're looking at all the different ways to reduce barriers. And that's why our mobile vaccine effort is so focused on going to all the different corners of this county, is because access is really important, and incentives obviously can mean something to people, and we want to make sure we provide that opportunity. But the most important thing is providing the vaccine access to begin with.
Thank you.
Any follow-ups on incentives? All right, we'll go back to Ryan from Redheaded Black Belt.
Thank you. I realize now I do have another question related to testing or screening, surveillance testing, and I'd like to try to address some nuance there. So bear with me, please. So we understand that the CDC does not recommend surveillance testing for vaccinated people unless they're showing signs of illness. However, there is concern that vaccinated people who frequently are not symptomatic, right? Even when having an active post-vaccination case of COVID, they may be bringing that virus into public areas. It just inadvertently. So please explain to what degree a vaccinated person would be capable of shedding the virus, potentially passing the virus on, and also what is the difference in the viral load with Delta between a person who has either natural active immunity due to maybe a recent previous illness, for example, or a person who is fully vaccinated or is unvaccinated. So for all three of those scenarios, what might be the difference in their ability to transmit the virus?
Great question. I'll do my best. It's a lot packed in there. So, I think the primary thing is we recommend following CDC and CDPH guidance. It's evidence-based, it's based off of the science. And so, really looking to that to make policies. But we understand there are organizations, businesses who decide to go above and beyond that, and that is their choice. And that's always been something that's happened throughout the entire pandemic. We encourage people to follow the guidance if they go farther. That is their choice. We just wouldn't want them to go less than that. The reason for the CDC guidance around fully vaccinated people not needing to do surveillance testing, it comes down to a couple of main factors. One is which is what we're seeing is that they don't spread the virus as easily as unvaccinated people. So, among household contacts, among close contacts, there's a lesser frequency of the number of people who they might infect. And that probably has to do, there's a lot of science going around this right now, and a lot of it's just very, it's unknown. We don't know all the answers why that is. There's some theories around it. Originally we heard things like the viral load was the same in the nose of someone who was fully vaccinated versus who was unvaccinated. And now we're seeing that probably while that's probably true, those viral particles are less infectious, and maybe because of their coating of the antibodies around them, that's much stronger in a fully vaccinated person than an unvaccinated person. The second piece of that is that the fully vaccinated people seem to be clearing the virus much quicker than someone who's unvaccinated. So on average, maybe only a couple of days versus that 7 to 10 day window that we have for the unvaccinated folks. So there's a longer period of time that someone who's unvaccinated who becomes infected sheds the virus. So those are a lot of the factors that go into that decision by the CDC and why they made that policy around not needing to do surveillance for those who are fully vaccinated, not recommending quarantine for those who are fully vaccinated who are exposed to the virus, and only to recommend that test at day 3 to 5. As far as, so I think that gets at the two differences between a fully vaccinated person who has a positive and an unvaccinated person who has a positive. As far as the post-infectious person, so someone who has natural immunity, the CDC currently is using the 90 days as a period of immunity based off of a lot of the data and the studies that they have at hand. There have been other countries who've extended that out to 180 days, like the UK. I don't know if the CDC is looking at that. I know there's a lot of debate in the scientific community about this and should that be a longer time period. But it does look like that 90-day immunity is quite strong. So these are the reasons for the policies that are implemented both federally and statewide and here locally, that if you were infected and you have a known COVID-19 infection, that in that 90-day period, you would not need to retest and you would not need to quarantine if you were exposed to someone with COVID-19. So that looks, we have seen very few repeat infections in that time period. It's not zero, but it's been very low. And so the immunity, at least in that time period, seems to be pretty good. The other thing I'll just say about immunity, and I mentioned on Tuesday, is this, idea of the heterogeneity of natural immunity versus the very homogeneous response to the vaccine. And so it's predictable. The vaccine response is predictable, whereas the natural immunity response is quite a bit more unpredictable.
Thank you. I really appreciate that answer and all the insight there. I appreciate your time on that. Thank you.
Any follow-ups on that question from other reporters? All right, back to you, Austin. From
Hello.
Northwest News.
Hi, I wanted to ask, I know you kind of touched on the booster shots, especially now that's available for residents. So can you kind of touch on a little bit more about the efforts in order to get people who are eligible for booster shots, their booster shots, and if how those figures are looking and whether people are coming in to get them as much as you'd like them to?
Yeah, I'd say from our public health run clinics, we are seeing significant numbers of people coming in for booster shots. So if, I don't have community-wide numbers, we're not getting this specifically from each, pharmacy and clinic, but if our own clinics are any representation, I think, people are definitely seeking out their boosters. We have, worked with local hospitals, long-term care facilities that we've worked with throughout the pandemic to, really educate and get the word out that we really would encourage them to give those booster shots to those people at the highest risk. So, I think we are starting to see that. And I think, part of that is we're seeing that decrease in hospitalizations among the fully vaccinated and also decreases in the case rate among the fully vaccinated. So, I think that's where the booster shots are going to have the biggest impact, are really, to decrease what we've seen in the last couple of months, which is, those folks who are at the highest risk, who are older, who have immunocompromised conditions, who were fully vaccinated, getting hospitalized and getting sick from COVID. And I think with these boosters for the older population, those who are over 65, for the immunocompromised population, anyone who has any of those conditions, that we will start to see that those numbers come down significantly.
Great, thank you so much.
Thanks, Austin. Isabella, do you have any additional questions?
Yeah, I actually wanted to ask about testing. So first, is testing still as impacted as it was, in the last couple of months throughout the surge? I know that was a topic of discussion during the Board of Supervisors meeting, talking about, if they do require employees to get tested, how that may, how that's actually going to roll out. And I'm forgetting some of the details of that conversation. So I guess, can you kind of remind me, and also, talk a little bit more about how that could roll out and if rapid tests would be a part of that testing option?
Thanks, Isabella. So I think some of the answers to these questions will probably come as the board makes their final determination about the vaccine or testing policy, and the CAO and HR would be developing the details about how that would get implemented at a countywide level as an employer.
Sure, thank you.
Just to speak more broadly, about testing in the community, though, we have seen significant decreases in testing demand over the last couple weeks, really. I think that with the surge subsiding, testing will go down. We saw a tremendous increase in testing demand, late July, early August. We were we were grateful to have a fast response from the state with adding extra resources at our Optum sites, bringing back our mobile Optum sites. So, that was helpful to that response, but we're now seeing, not just here in Humboldt, but across the state, significant decrease in testing demand. Utilization of the Optum sites is, now under 50%. We'll be, I'm sure, seeing decreases in that demand going forward, and we'll respond appropriately. As far as the rapid testing, again, that's a nationwide issue. It's starting to ease some. For the entities who locally, can utilize the mutual assistance programs, we have those tests available for them. We have tests available for the schools, but for a lot of the state-based programs for businesses and other entities, it is really tight right now for those rapid tests. So that was part of just letting them know about what's going on so that they can form their decision. But PCR testing at the state is very open. There's plenty of capacity for PCR testing and state-based programs for businesses who are implementing a testing program for their employees can utilize that state-based program to do PCR on their employees weekly as a surveillance. So we certainly encourage any business who's looking at doing a testing surveillance program for their employees to look at that CDPH testing task force website to get more information about what's available through the state.
Great, thank you for talking about that as well.
Thanks, Isabella. Ryan, any additional questions?
Yes, I have one more. So both Trinity and Mendocino counties, which are, smaller and arguably with less resources, have been able to provide responses to reporters' questions as needed. But Humboldt County only allows these press conferences, which I understand would ideally take place every other week or so. So twice a month, but we haven't really been getting that recently. We had July 21st, August 26th, September 8th, and 29th, and now today. So would Humboldt County Public Health Department consider fielding questions from reporters apart from scheduled press conferences? And then why or why not? Thank you.
Brian, thanks for the question. So I think prior to the Delta surge, I think we were definitely looking at, as things were winding down, looking at what our processes are. And it is really important to provide these venues for the media to ask questions, right? Like, we want to make sure that we're providing information to the public in all the variety of venues where people seek information. We also have a presence at the board supervisors meetings, providing, the health officer provides the report out there. So I think as we've been through the surge, that definitely has, our top priority is to respond to the emergency that's in front of us, and making sure that we provide time to answer these questions so that the community can get the information that they need. It's really tough to strike that balance, but I appreciate the question, and we definitely want to make sure that we're doing whatever we can to provide information out to the public. And the media is obviously a very important part of that. Mariah, I don't know if you have anything else to add.
Yeah, just to clarify, Ryan, any reporter can submit questions at any time to dhsmedia@co.humboldt.ca.us, and we'll work to get answers to everyone's questions in a timely fashion. It's when a question is policy-based and requires an answer from the health officer that we'll ask reporters to ask those questions directly of the health officer, who is made available, or the public health director, or any of our other panelists, who's made available in these sessions, so that you can ask directly, ask follow-up questions. And this is different from our previously recorded media availability sessions, which didn't allow the opportunity for follow-up questions in these conversations. So this is what we've moved to now, and I think, as we've said before, we would like to be able to meet in person to have more direct communication, and we'll continue to look for opportunities to answer questions in a more timely fashion. But there is nothing. We regularly respond to reporters' questions about COVID-19 outside of these outside of these news conferences, and we'll continue to do so. So again, you can email questions to dhhsmedia@co.humboldt.ca.us anytime. And if it doesn't require a response from the health officer, we'll get back to you.
Okay, thank you for clarifying all of that. I do want to just, is it my understanding now that in order to get a direct answer from the public health department, whether it's Dr. Hoffman or Sofia, would an email not be sufficient, or do we have to wait for a live press conference, which, by the way, is greatly appreciated, and the opportunity for follow-ups, is invaluable. So thank you again for that.
I would just say an email is sufficient, again, if the response doesn't require a direct answer from the health officer. And if, sometimes a question will be asked and we can provide whatever information we have available, but then we'll point people to either a Board of Supervisors report, perhaps a written report that's been provided to the Board of Supervisors, or to the news conferences.
Noted. Thank you.
Thank you.
And really quickly, I just want to give a shout out to our Joint Information Center staff. Staffing challenges have definitely been something that's come up in this surge in particular. And so I just want to recognize our hardworking staff that do make sure every day that information is getting out to this community. So I just, Mariah obviously is a big part of that. But there's also folks that you haven't had the opportunity or privilege to meet that work incredibly hard every single day to respond to the community and provide information. So I just wanted to recognize their hard work too through a really difficult time.
Thank you. Isabella, any additional questions?
No, I think you guys covered it. Thank you.
Thank you. Ryan, I'm sorry, I didn't come back to you, Austin. I apologize. Austin, any additional questions?
No worries. I do have one final question in regards to the idea of a national vaccine mandate and what's been going on with OSHA. I was just wondering what your thoughts are on that, and whether you would or wouldn't support a national vaccine mandate of that scale.
Austin, great question. And Dr. Hoffman, feel free to add on. I think as we've stated time and time again, as public health, we want to make sure that we get the vaccine out to folks. Obviously, there's going to be decisions made at levels far above our level here at, if we're talking the federal level, for example. And so, we will be paying close attention to what policy direction is coming down from the federal government or from the state government. But our focus is making sure that we're providing vaccine access in this community. So that is why we're focusing on getting our mobile vaccine team out to all different parts of the community to make sure that the vaccine access is there for whatever reason why folks may be seeking the vaccine.
Perfect. Thank you so much.
Thank you, Austin. We got a little out of order there. So Ryan, any additional questions?
I think I've got it covered. Thank you.
Great. There are no additional questions. Thank you all very much for joining us. I'll get the recording out to media as soon as I possibly can, and have a great day, everyone.